Hi, Steve Adler. Good evening. You got a minute? All right, so let's talk about the numbers that we have today. We're going to go straight to them, pulling up the first dashboard that we have on the city dashboard site. Always starting with new hospitalizations. We had 57 tonight. That is just about our 7-day running average. So the numbers actually come down a little bit, still higher than our 7-day running average. It's all relative. 7-day running average, 55.1. Remember that for total hospital beds, we could go up to 70. And then we have to check and see if we're going up way too fast, in which case we have to take action. If we've slowed it down, with people wearing masks here this past week and staying home more, then maybe we can go into the 70, maybe as high as 123. But it all depends on whether people are voluntarily adopting the behaviors to wear masks and to stay home more. Number of new cases today, just under 600. We had 597. That's still a concern. 504 is our 7-day average. Again, as we talked about yesterday, in the last 14 days, the number of tests have gone up 60%. So we have tons more tests than we had before, but we also have over 200% in the number of cases. So it's not a question of us having more cases because we're doing more testing. We have more infection. The doubling time in our city continues to drop. We were at 13.8. This is the number in the lower right-hand corner. We were doubling every 13.8 days, now down to 12.9. It wasn't, but just a few weeks ago, we were up at 42 somewhere, more than 40 as a doubling time. Take a look at the number hospitalized. 7-day running average is 339. We'll see in a second that the actual hospitalized tonight is 376. So again, that's running faster, hotter than our 7-day running average. ICUs, 120 is the running number. We have 133. So our actual number, again, higher than our 7-day average. Ventilators, 7-day running average is 56. The actual number tonight is 67. Why don't you go to the next dashboard? This dashboard also is up on the city website, but it has the numbers I was giving you for the hospitalizations and ICUs and ventilators that we have tonight. That other page was the 7-day running average. This tells you what it was today. In the middle there, hospitalized 376. The 7-day average was 339. ICUs tonight, we have 133. The 7-day running average was 120. Ventilators, 67 today. 56 rather, is the 3-day running number. You know, I'm concerned about, we talked about total beds. I'm also concerned about ICU beds. I'm concerned about ICU beds because they're more limited than total beds. ICU beds is what we hear was the first thing to really fall short in Harris County and Houston that we're watching right now, and talking to folks in San Antonio. That looks like that may be where we feel our first biggest stress, even before we have a stress for total beds. And for ICUs, it's not just the beds, it's the hospital staff. That's even harder to plan for than the beds themselves. It's the staff, it's the nurses and the doctors. It's having nurses and doctors that are trained to do ICU work. You know, one of the reasons why we have to keep this number low is we need to protect the doctors and the nurses in the hospital. The more folks we have going to the hospital that are sick, invariably the more hospital people that get sick as well. So not only do we need to hold and preserve and get additional ICU staff in order to maintain the care levels we want, we need for those folks to be healthy. If they get sick, they have to go isolate for 14 days. So it's all wrapped up, and that's why we have to be vigilant. But we're going to take a look at those ICU numbers and take a look at them a little bit more closely now that we see what's happening in other places. If you go back to that chart for just a second, Anita, what we didn't talk about was the total count. Tonight, when we went up by 597, it took us to 10,124 cases. That's the number in white to the left. So this is the day we went over 10,000 cases here in Austin, Travis County. 10,000 people confirmed with the virus. And I've heard numbers that suggest that for every person we catch, there are 10 people we don't catch. If that was the case, there could be like 100,000 people in our community that may have gotten the virus. We know that the infectivity numbers are rising. So the chances when you go out that you'll run into someone that has the virus much greater today than just a couple weeks ago. Okay, so let's come out of that. Let's talk for a second. The 30,000 foot view of what we're dealing with here. The European Union, you may have heard, and has now reopened its borders to let people come to the European Union from around the world. They've opened up Europe to a dozen different countries. Notable among those dozen countries is you will not find the United States. So they believe at this point, given the infection levels in the United States, that travelers from the United States present too great a risk for them in Europe. Their numbers are lower than ours. Where the United States numbers continue to accelerate, they've taken their numbers down. And it's just real telling, I think, to have reached a place where the United States is a country that presents risk to others around the world, actually a risk to one another, but also a risk to others around the world. There was a new dashboard that was released today by some researchers at Harvard. It was to allow an apples-to-apples comparison between cities and counties around the country. It shows Travis County as one of the most affected areas in the country. I am pleased to see that this issue of public health that has for too long been too politicized, especially as concerning masks, now looks like it may be not as politicized, or hopefully getting to that place where we can move past the politics and just focus on the science and the data, including this study from Texas A&M that said that masks are effective and perhaps the most important thing that we can do. It was good to see the vice president visiting Texas, wearing his mask most all the time. It was good to hear the messaging, the mask from the governor. Still wish that we had the opportunity to make it mandatory, not just in businesses, but outside. But if you look around the country, more and more Republican leaders begun publicly supporting face masking. That would include Senator Mitch McConnell, who said today that there should be no stigma attached for someone that is wearing a face covering. Reuters doing a poll of people in the country looking at Americans has determined that 81% of Americans right now are concerned or somewhat concerned about the pandemic. That's the highest number that we have seen in our country since May. The fact that this is becoming less political, I'm encouraged to see that the numbers are rising significantly among Republicans that were a little bit more hesitant to support the wearing of masks earlier, and that's good to see. This is not a partisan issue. This is purely a science issue that we have. And bottom line is we have to be more vigilant about distancing and protecting vulnerable populations. I think it's interesting that according to a poll by Live Science, over half the people in the country that become confirmed cases have no idea how they got the virus. Over half the people do not think that or do not know that, to know of anyone that they were in contact with that they think had the virus. And that just shows you that when you head out, over half of you are going to find it in a place that you're completely unaware of. According to the poll, when patients could report a contact that they thought they had gotten it from, more than anything else, it's coming from a coworker or a family member. In this city, we're finding that a lot of the additional cases we have are associated with families. A worker, perhaps, that gets it at the workplace, comes home, and then the family gets infected. What we're finding is a lot of the people that end up in the hospitals are people that are family members of someone who was infected, and that's how they end up there. Remember, the city of Austin has a hotel facility that if you call 311 and need a place to be able to isolate because you can't, there's the phone number 512-810-7554. If you can't isolate at home, if there's not a way for you to have a bedroom and a bathroom that just is something that you use, call that number and see if there's a isolation place in just a hotel room, motel room that your city can get for you. Remember to go to my website if you want to look at the research indicating that masking is effective. The people we need to cocoon most: older people, those with an underlying health condition, those with an income less than $25,000 a year, and then folks that are non-white, folks from communities of color. It's interesting to note that many of the people that are infected with this virus in our city and in the country are people that did not have the option to work from home. Many of us in Austin have that option. Not all of us do. But of the people that get infected, about 2/3 of them say that they were employed. The other third were not, probably at home, getting it from someone that brings it home. And of those that are employed, only 17% of those people who got infected were people that were at home teleworking, which means the other 83% were people that were not able to work home teleworking. It's also interesting to note, relative to what I said earlier, that 25% of the people that are showing up being infected are healthcare workers. When we get the virus, we do more than just put ourselves at risk. We're putting those healthcare first responders at risk as well. These insights confirm what we've been talking about. Every contact with a person outside your household presents a significant risk, a chance for the virus to spread, and the disease hits the people who are the most vulnerable. Hey, this weekend is July 4th. I know it's really hard on July 4th to not join a group, public group, private group. We have to be especially vigilant this July 4th. We had a surge after Memorial Day. As we were coming out of April, we were opening up the economy. Everybody felt good, like we were past what we were doing. Wasn't the case. And we had, that really kicked us off in a bad way. This is a July 4th weekend, and I urge everybody, celebrate July 4th with your family at home. Good time to talk about the founding of the country. Watch fireworks on television. I know it's going to be hard, but we really need to do that. There was tonight a reverse 911 call that hopefully you got this evening. I got it this evening. I'm trying to find where it is in my where it is in my phone. If you didn't get it, one, you need to find out how you can actually get these reverse 911 calls on your phone. But most people in the city and the county tonight got a message that said the coronavirus is spreading rapidly in Austin, Travis County. Stay home, avoid non-household gatherings, keep 6 feet apart from others, wear a face covering, wash your hands frequently. Important information on how to celebrate the 4th of July safely, and then there's a link that you can go to. People should start making plans now to spend July 4th at home. We're continuing to watch the numbers to figure out what we need to do in this city. Just real briefly, just to touch on real fast, there are really 2 options, I think, that are in front of us if we assume that we're not willing to just let this infection run wildly through our city and have people at the convention center and just to accept that as a given. So if you pull up the first graph, Anita, one of the 2 options we have is what we have here. This is if we were in yellow. Yellow was where we were all living lives like we did back January, March. We're now moving into that orange area. Orange area means we limit contacts, means we don't go to restaurants the way that we were before. It means we're wearing face masks everywhere. We're social distancing. We're really using the discipline that many more people have started doing the last week. We need even more people to do it. But if we get lots and lots of people to do it, we can get almost everybody to do it, then we can stay in this orange area without having to do a shelter in place, and we stay below that 1,500 benchmark that you see, and we can do that all the way through the end of the year. We can open up schools and live our life except with masks on all the time. It becomes just part of our life and part of who we are. Social distancing, it becomes part of our life and part of who we are. Very different than we have been living in May and in June. Question is, can we do that, and how quickly can we do that? If we can't get there real quickly, we go to what is, I think, a second possible future for us. And it's if we can't turn on a dime, if the numbers don't look like we're slowing it down. This is another chart. This has us going into a red zone. Red zone means it's kind of like the shelter in place we had before. Still would have us being able to do curbside and delivery from restaurants, curbside pickup from retail probably, but no in-store shopping, no in-restaurant eating. Face masks everywhere, everybody staying at home except for essential workers. We'll be returning to that place. We could do it for 35 days. We would know at the beginning we're going to do it for 35 days. We can count down the number of days. But in either of these scenarios, we get back to orange. You can see schools are open all through the fall. Those are the 2 different options. If we show discipline on our own, get to orange fast right now, see a difference in the numbers. We don't have to do red. If we can't turn on a dime, maybe we have to do red for 35 days and then we get to orange. All right, Anita, if you pull out of that, that'd be great. Either way, we have to start thinking about a future in this city where we're hopefully opening up the economy, but living differently than we did in January and February. We have to start thinking about what it's like to go to a bar and still have face coverings up most of the time and social distancing, not clumping together, being in a small group. Maybe it means that, you have only one small group of friends that you go to a bar with so that you're not with, 15 people this week, 15 people next week, 15 different people the week after that. We need to start thinking about how we do restaurants in a COVID world where we're masking more and social distancing better. How do we do retail differently than we've done it before? We've had a lot of restaurants and a lot of retail stores that are doing a really good job of washing things down. And as we saw in May and June, that's not enough. We really have to rethink how we do restaurants and businesses and offices and whether or not we really need gatherings over 100 for any reason. or whether until we get the vaccine, whether we can do without any groups over 100. But we need to figure that out because that's the only way we're going to be able to sustain opening up an economy. It's the only way we're going to be able to sustain keeping schools open. It's going to be a real change for us, but we need to start thinking about what that means and how we do that if we want to be able to save lives, keep the economy open, and still keep open schools. I want everybody to be thinking about how we live in that orange area, because we're going to have to do it for an indefinite period of time till we have a vaccine. All right, I'm going to close out the show here tonight by talking about the mailbag a little different tonight because I don't have a photo. We actually have a video, but before we start the video, I want to note that this Got a Minute is not only now on just Facebook, but we're also on YouTube. So there's a YouTube link, so people that don't have access to Facebook can also watch this on YouTube. But here we are. A local mom has given me an idea. I've been asking a lot of people not to go out and do a lot of things that are a lot of fun. No big barbecues, no big groups at parks and beaches and at pools. Well, here's a mom that was out with her son who was looking at a cave. He wanted to go in to see, go a little cave exploring. And mom said that the mayor suggested that they should wait until after the virus. Of course, for kids, there's a really thin line between asking and bargaining. And I seem to have gotten a pretty cool offer out of this deal. So, Anita, why don't you go ahead and play the video that got sent to us?
Okay, Steve Adler. I want to go visit the salamanders and the bats and the ants and that little worm thing. I want to go visit them down this cave.
Okay. When can we do that?
When sickness is gone.
Yeah, let's do
And
it.
you can come with us.
Ooh, that'd be fun. That'd
Yeah.
be great. We'll make it happen.
Yeah.
Okay.
I can bring this hat and I'll bring my headlamp so there's light.
Woo, good planning.
Deal?
Well, I want to go down that cave. I want to see the bats and the bugs too. After the sickness is gone, sounds like a great time for me to be able to join you. I love the hat. You wear that hat. I'll find a hat that I can wear too. Now I have something else to look forward to. I just really appreciate your just absolutely adorable patience with the fact that we're not doing everything that we want to be able to do during this period of time. Hey, if you guys have anything to send to me as part of the mailbag, please go ahead and send it. There's the banner at the bottom of the screen. And for now, that's all the news that I have. You all take care. Good night, and please be safe.